Hi, everyone. Welcome back to this week's episode of Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida, here as always to talk with you about COVID-19, mental health, and how we're all going to get through this journey together. So, with me today, I'm very excited to welcome my guest, Pam Binkley. She is the Recovery and Resiliency Manager for Florida and Tennessee with United Healthcare. Pam, how are you doing today?
I'm doing well, thank you.
Wonderful. So we're here today. We've talked before about mental health first aid, but we're kind of here today to talk about um, the virtual aspect of it. In the world that we're living in, we're getting into an era of, especially with COVID, a lot of things were already virtual. And I think moving forward, there's a greater chance they will continue to be even after things settle down with the pandemic. Would you agree?
Oh, definitely, yes.
All right. So first, I'll get started asking you about just general mental health. But what is mental health first aid?
So, mental health first aid is aid given to someone experiencing a crisis, um, similar to CPR and first aid for physical health. Mental health first aid kind of addresses and helps you learn some tools to support someone in a crisis for mental health.
Okay. And to kind of add mental health hits a lot of us in a personal aspect, whether directly or indirectly. What does mental health first aid mean to you?
So, mental health first aid has been kind of a lifesaver at times because you learn a lot of ways to support individuals, but some of that support I've been able to help myself. I myself have lived experience, and um, and it's been going on since the 70s. So I've gone through various periods of when services were not so great to now they're so much better than what they used to be. So having mental health first aid out there, I think, will give people additional tools that they can use to help someone, whether it's a family member or a friend, or just having that knowledge. And it's another way too that I have used to decrease stigma around mental health
I
is
think
having
that's
a better
wonderful.
understanding of what mental health is itself.
That's really wonderful. Thank you for sharing that. And so, one of the things that we talk about here, like I mentioned, is COVID-19. So, how do you think someone being certified in mental health first aid could help them or help those around them during COVID-19 social distancing period? I know that technically a lot of us are, not necessarily quarantined anymore, but we're still social distancing, at least to a certain extent.
Definitely. And I am a hugger.
Me
So
too. I
so
really
with
am.
COVID, it's like you're supposed to keep that 6 foot distance. And I even try to do that with my family, especially my dad. He's 84. We're not having Thanksgiving this year. And so that to me, that really brought me down because I'm so afraid that he won't be here for next year's Thanksgiving. So I'm trying to reach out and make those extra calls and things like that because I can talk to him over the phone. He has nothing to do with technology. He doesn't want anything to do with FaceTime. And I can understand that. Um, so just using the mental health first aid tools and also the virtual learning, you'll be able to learn all of that without being in a classroom side by side. Um, like you, I'm kind of one that gets out into the community. Every position I've had in mental health, I've been able to be in the community. COVID just kind of threw me for a loop, and I saw my depressions beginning to increase. Um, and so I ended up, instead of doing a lot of medication adjustment, getting an emotional support dog. So I picked up Buddy. He's from the animal control, and I use him as a tool as well. And that has helped me tremendously. But as far as the virtual mental health first aid, it just gives you another set of tools to be able to use with someone. And what I like about the virtual is that you're going to get to see people, you're going to get to learn new skills, and the manual that goes along with mental health first aid has a wealth of knowledge that even in the limited time that you're in class, you would not be able to cover everything in the manual. However, in virtual, you will have access to an electronic version instead of a hand version. So you would be able to always go to that or print off whatever you would want to keep and that type of thing.
That's awesome, actually, to hear. And so that virtual aspect, is that new with COVID-19 where now you can do the class virtually?
Yes, it's definitely new. We wasn't sure how long COVID was going to last as far as the distancing and not being able to gather. And so the National Council, who worked with the University of Missouri to develop mental health first aid into, in fact, it came from Australia. So they worked together to really bring it to the United States. They decided, this is a tool that people need, the information people need. How can we get it out there to them? Because before it was an 8-hour in-person class. And so they worked really diligently to put together a plan. And so now you have 2 hours of online learning prior to the class, and then 4 hours of virtual learning with an instructor. And for myself, I was trained back in 2010. In fact, I was the very first class of peer specialists trained in
Wow.
mental health first aid to teach. And so we really were able to bring it from a lived experience realm, which was so different than the clinical version. So taking it and using our own life experience as we teach it has been really good. But back to the virtual piece. So they developed the virtual thing, and what they did was have current instructors like myself. I went through 2 hours of additional training virtually to help learn kind of the differences and stuff. And so the first part of mental health first aid is learning more about the illnesses themselves. And so you would get that training now online if you registered for a course. And then once you complete that, you're able to attend the training in person. I'm sorry, virtually.
I know what you mean. Yeah, with the in-person of 2020.
Yes, the in-person of 2020 through the screen. And then an instructor would help you through the other parts of how to support someone experiencing a mental health crisis. And, mental health issues have gone up tremendously because of COVID.
Yeah, mental health, substance use, domestic violence. It's been a very, I think the word to use is interesting time period, I think, in all of our lives, and probably will be in history to come, because you're right, mental health, I think, I'm hoping, and I think this is kind of what's happening, is that mental health is starting to take more of a view of being a prominent thing, an important thing that we all need to take seriously. And so that actually kind of leads me into my last few questions for you. You mentioned that there's this training and it's awesome. And I think that for some people, and they might even feel this way about CPR, it's like, who can take it? Can anybody take it? Do you have to have a degree? Who can take it? Can you tell me a little bit about that?
Sure. So anyone can take this. One of the things I like to do is I really enjoy working with just individuals from the community, because I feel like the more information we can get out there, the less scarier it seems. And also, if I'm sharing a little bit about myself throughout the training, there are so many people that will come up later and share a little bit about themselves where they haven't felt comfortable in getting that information out there. So definitely anyone in the community could take this. You never know who you're talking to, that they might have something going on, and you never realize just some little something you say just makes their day. Sometimes giving them a smile, but those are the things we talk about, and I think the information is good for anyone.
Okay, so you have to be over 18 to do it, I'm assuming?
Yes, over 18. There is a youth mental health first aid as well, but that's for people in the community, instructors, teachers, that type of thing, learning more about youth. Yes,
Gotcha. Okay. And do people I'm assuming they sign up online?
Yes, you can sign up online. For whenever I provide the classes, they're free of charge. My agency covers the cost. But there are some that cost a little bit, because we do have to pay for the seat in the class, that type of thing, manuals, anything like that. But we're just so interested in getting this information out there that we don't provide a charge for that at all.
I think that really speaks to your agency, their mission, and just wanting people to get help. I really think that's wonderful.
Right.
And would you be all right if we share that link to the website or some kind of information with our audience?
Oh, definitely. Yes, please do so.
All
And you
right.
can find trainings on that website in your locations.
Absolutely. Well, that's wonderful. Thank you so much. Well, I think that's all the questions I have for you, Pam. Was there anything else you wanted our audience to know about mental health first aid?
I can't think of anything. I know. I just want to share a couple of things with them. Is back in the 70s, I was diagnosed with major depression and anxiety disorder, and the one thing that I did was I didn't get help for quite some time. Having finally gone and got help, I realized how much better my life could have been.
Sorry, that was my dog.
I didn't hear him. I realized how much better my life could have been. And so I just really want to tell you, if you're listening to this video and you're uncertain, just to reach out there and ask for some help. It's okay. It really is. And I'm so glad that I went and got help when I could. Um, yeah, life can be great, even in the midst of this COVID stuff. And we might tend to forget that for a few minutes, but just having information, a peer group, anything like that, I think helps you to get over this hump and realize number one is you're not alone. There are a lot of people out there. So let's all stomp out stigma together.
I think that's a wonderful way to close. And I'll just say thank you again for being here. For all of you watching, as Pam mentioned, please, if you're feeling any sense of anxiety, depression, really anything, and you don't feel like yourself, please reach out. There are many resources. Our resources with the Mental Health Connections program, I'll include our link as we always do. We have our support groups, but we are here for you. And as Pam said, it's okay to get help. So with that being said, thank you again, Pam. Thank you to all of you. If you have any topics you want to see, anything like that, please reach out to us, and I will see you next time. Thank you.
Bye.